Hi everyone. This study is titled Understanding Exercise-Related Barriers, Facilitators, and Means of Hard-to-Reach Female Cancer Survivors. Exercise has been shown to be safe and feasible for cancer survivors, but less than 30% of survivors engage in regular exercise. So how can we get more cancer survivors active? Well, the general population of cancer survivors report a number of exercise barriers, facilitators, and needs. Yet, there's limited information to describe these factors for hard-to-reach populations. Hard-to-reach populations are defined as groups of the population that are difficult to involve in public health programming and research, and so barriers, facilitators, and needs may differ for this group of cancer survivors. And so the purpose of this study was to identify the exercise-related barriers, facilitators, and needs of hard-to-reach cancer survivors. To achieve this purpose, we recruited 24 hard-to-reach female cancer survivors from community cancer organizations. 10 participants were young adults aged 18 to 39 years. 9 were living in rural or remote communities as defined by Statistics Canada. And 4 were living in an area of low socioeconomic status based on census data. Finally, 1 participant identified with both rural and remote and low socioeconomic status groups. We conducted individual semi-structured interviews asking questions that explored their barriers, facilitators, and needs. Interviews were analyzed using conventional methods for descriptive qualitative studies. Themes unique to each hard-to-reach group are presented here. Young adults reported that exercise programs were not age-appropriate and lacked intensity, and described a need for programs for younger survivors, as one young adult noted that connecting with people who are their age and going through cancer is important. Those living in rural and remote communities discussed that current exercise programs were not accessible due to location, nor appropriate, as they were not survivor-specific, as one survivor expressed that it is a barrier to stand out in an exercise class. Therefore, survivors reported a need for survivor-specific programs with similar others. Finally, those living in areas of low socioeconomic status reported cost and lack of support from oncologists to be barriers, with a survivor stating that after treatment, there was no way they'd be in a financial position to join a gym. These survivors recommended providing access to free community programs and healthcare professionals trained in cancer. Common among all hard-to-reach groups, survivors reported there was a lack of exercise information. Yet, exercise information from their healthcare team facilitated exercise, as one survivor reported that their oncologist recommending Wellspring led them to enroll in the program and attend each week. Survivors expressed that improved exercise information, especially in online formats, would be helpful. Also, commonly reported by hard-to-reach survivors was a need for improved accessibility, as one survivor noted that she would want all communities to have facilities like an indoor pool. As well, survivors described social support as important for facilitating exercise, with one young adult stating that going to classes with other young survivors normalized the experience for her, and this was helpful. A number of these findings were consistent with those of the general population of cancer survivors, yet there were some unique results for each group that should be considered when designing exercise interventions and programs. Overall, there is a need for programs that are individualized, include a social component, have online options, and are survivor-specific. In conclusion, clinicians and researchers should use this information to design meaningful exercise interventions and programs to meet the needs of this hard-to-reach group of cancer survivors. I would like to acknowledge my co-authors, as well as the CIHR Fellowship for funding this project. Please feel free to email me if you have any questions or would like any more information. Thank you for listening. Stay well, everyone.